Good evening, I'm Kevin Gefeller.
And I'm Rhea Cha. Thank you for joining us for 18 News at 6. The grim milestone was reached at stunning speed, just 27 months after the country confirmed its first case of the virus. And while COVID deaths are slowing, on average over 350 people a day are still dying. Meanwhile, hospitalizations here at home are rising. Our 18 News reporter Sarah Wilson has the latest on the state of the virus.
The numbers are trending in the wrong direction. Across the majority of the southern tier, COVID-19 hospitalizations going up. In some cases, nearly 50%.
I think it has to do a lot sometimes with the level of elderly patients that we have per the small area that we're in the southern tier, compared to also having people that live at the poverty lines.
Cases have been climbing since early April, but are much lower compared to the winter surge.
Now, at that point, we were seeing 30% of our inpatients were COVID positive, and now it's much more like 7 or 8% most days.
In central New York, state data shows hospitalizations are starting to level off, a positive sign for the southern tier.
We're hopeful that we're going to soon be seeing a peak here.
I would think we'll continue to climb probably another few weeks here. It should level out and plateau.
It's not just the southern tier seeing an increase in hospitalizations, it's also all of New York State. Our region is just admitting more people to the hospital on average. All of this comes as the U.S. hits 1 million COVID deaths. The southern tier, just a fraction of the grim milestone. Since the start of the pandemic, the region has reported nearly 600 deaths, the majority of them in Chemung and Steuben County.
Though I am troubled, the numbers have gone up a bit. If you look, the death rate, Sarah, is not. The death rate has continued to decline.
Some positive news amid the tragedy now totaling 7 figures. For 18 News, I'm Sarah Wilson.